So what you always want to have is in the hands of a surgeon, in that rare case that a complication occurs, that they have the experience and the ability to resolve the issue. It is imperative to be able to communicate with that surgeon. It's imperative to be able to look at that patient, the patient look at the surgeon eye to eye and be able to communicate. Okay, so you finally have made a decision to undergo a cosmetic surgical procedure. What do you want to ask that plastic surgeon? I believe that there are a number of issues that need to be asked. First of all, are they certified by the American Board of Plastic Surgery? I think that this is extremely important. Once you have verified that they're certified by the American Board of Plastic Surgery, how much experience do they have? Do they have 5 years experience? Do they have 25 years of experience? I think that this is important. I don't think that there's a surgeon on earth that would tell you that he has done all of these surgeries without any complications, because that's just not right. That's just not the truth. So what you always want to have is be in the hands of a surgeon, in that rare case that a complication occurs, that they have the experience and the ability to resolve the issue. And most important is that you have the trust in their ability to do so. I think that there are other things that I believe should be looked at when selecting a plastic surgeon.
The issue of the American Board of Plastic Surgery has now gotten confusing because there's the American Board of Cosmetic Surgery. That's not a recognized board by the American Board of Medical Specialties, which is the umbrella for all the recognized specialties in this country. So sometimes patients need to differentiate between a plastic surgeon who is under probably 7-8 years worth of training in the surgical specialties and then specifically in plastic surgery, to a cosmetic surgeon who in their previous life maybe was an internist or a dermatologist or an orthopedic surgeon or a gynecologist who has taken weekend or 1-week courses in aesthetic procedures, has become a member of the American Academy of Cosmetic Surgery, which does not have a rigorous examination process like the American Board of Plastic Surgery. You basically pay your dues and become a member, and now they put the diploma up on the wall, and patients are confused because we use the term cosmetic surgery interchangeably with aesthetic surgery. What's the difference? Probably just semantics, but the difference between the surgeons is like night and day. You're looking at 8 years of specialized training by individuals who have devoted their lives to plastic surgery training versus a week course or a weekend course by individuals that, who knows if that's the blind leading the blind.
I think once you've established that surgeon is being certified by the American Board of Plastic Surgery, it is imperative to be able to communicate with that surgeon. It's imperative to be able to look at that patient, the patient look at the surgeon eye to eye and be able to communicate. You cannot establish trust via an email, via the website. You have to be able to at least communicate on a one-to-one with that patient. Trust is a treasured thing, and not everybody has the ability to inspire trust. I think one of the things that I emphasize with patients all the time is I happen to come from 4 generations of physicians in my family, and my father, rest in peace, always used to say the same thing, that trust needed to be earned by an individual, never freely given to the title. The fact that you're a doctor doesn't mean that you need to be trusted. A patient should not trust a doctor just because he's a doctor. He should trust the doctor because that individual who has earned the title of MD is worthy of the patient's trust.